having a good Sunday. I had gotten an excellent question and I wanted to share the answer with all of you because I think it's going to be really helpful. So the question that I got was, how do you know if it's mental self-care that you're doing or if it's laziness? Because during quarantine and social distancing, the person was feeling that there was a very fine line between the two. And I thought that was excellent because it can sometimes get a little bit blurry. So the first thing I would do is challenge you to ask yourselves how you define laziness, because everybody's definition of laziness is different. So I hate working out. I hate it. I play tennis. I don't do workout classes, but because of the quarantine, I can't play tennis, so I am doing online classes. Now, I'm aiming for one a day. That doesn't happen. So maybe I'm averaging 4 a week. To somebody, 4 a week may seem insanely lazy. For others, that may seem insanely absurd. And for me, it feels just right. The other thing to keep in mind is that self-care and mental self-care is not a constant. The amount of it, the form of it, the frequency of it is going to change significantly based on the circumstances that you're in. So right now, for example, and there was an excellent article posted in Philly Mag about this recently by Ernest, and I'm forgetting his last name, I apologize, but read it because it pertains to this. That, this isn't like a snow day from school. This is a global pandemic. People are starting to feel lazy because they're being told to pick up a new instrument, pick up a new language, do something you've never done before. So here's my thing about that. Yes, we're home, we're inside, we can't do anything. But during times of intense anxiety, your cognitive resources are depleted. Meaning, if you think of your brain as a pizza, think of how many slices right now are taken up by worry, anxiety, quarantine, people getting sick, finances, all of that stuff. Your brain's overloaded. It's probably close to capacity. So why would you pick up something that has such a significant learning curve like taking up a new instrument when your cognitive resources aren't there? What's going to happen is you're going to set yourself up for failure. Then I guarantee you're not going to do anything else, and then you're going to feel lazy. So you have to make sure that you define what laziness is for you, and you have to make sure that the task you want to take on makes sense within the current situation, because you don't want to set yourself up for failure. If you're getting done what you need to get done and you're getting it done well, and you want to take a nap, that's not laziness because it's not interfering with your functioning. You're still getting what you need to get done. So don't be so hard on yourself. Laziness is not the same thing as taking a much needed break, even if that break is a couple times a day. And there's always going to be somebody who looks like they're running marathons for breakfast. But that doesn't mean that they're not as lazy as you. Some people overdo things to a high level because the alternative for them is unbearable, meaning they're doing these things at these high intensities to avoid feeling bad. They can't just be because it's too uncomfortable for them, because they're avoiding some sort of internal ickiness they don't want to feel. So be careful not to look at the extremes. You're doing great, and hang in there, and this will. The last thing I do want to add, though, if you feel that it is getting increasingly more difficult for you to get what you need to get done, if you find that you are having difficulty getting out of bed, you're having difficulty motivating to the point where it is interfering with your functioning, you may want to check in with a mental health provider. Most mental health providers are doing teletherapy now because you just want to make sure that you're not suffering from symptoms of depression or anxiety, which right now would be normal, but you just want to make sure that if this is the case, that you do get the help that you needed, because the help is there. Okay? Everyone have a great night, and I'll speak to you soon.